The South African Medical Association is accusing the Limpopo Health Department of risking the lives of two doctors. Now, both doctors tested positive for COVID-19, and it's alleged they were forced into quarantine at a multi-drug resistant TB hospital. The two had been in self-isolation. Sama says the approach could have unintended consequences.
We had a case last night with the MEC, where the MEC of Limpopo clearly stated to two doctors, and you can go on the SAMA website and you will see this whole drama that unfolded yesterday with these two doctors. She made it clear that they will not be treated differently from any of the patients. They are just the same, and which we accept. But then subpoena them with a court order to be going into forced quarantine after the guidelines is clear that if you have contracted the virus, you have the means to self-isolate, you're not sick enough to be hospitalized, then you stay at home. So that drama unfolded last night. So you know, I'm not sure anymore, because you know, for the MEC of Health, they need to understand the guidelines that's coming from NICD, and it's coming from the Department of Health. So we all try to get guidelines in place. Then an MEC of Health goes and totally buggers up the guidelines. Then you get, on the other hand, the department, the Minister of Transport also saying, you know what, social distancing, no, just wear a mask.
Now, for more on that, I'm joined via Skype by the Health Department in Limpopo's Head of Department, Thokozani Mhlongo. Thokozani, thank you so much for joining us this morning. Some really concerning allegations coming there from the South African Medical Association. Your department's response to that?
Good morning to you and the listeners, and thank you very much for affording us an opportunity to respond to the allegations. Firstly, I must indicate that the allegations are misdirected in the first place, in that the MEC for Health is not responsible for implementation of protocols and guidelines. If anything, I'm the accounting officer of the Department of Health. If there were any allegations leveled against, they should be leveled to me and not to the MEC for Health. So we take that into serious light, that there is a personal vendetta against the MEC for Health, because it cannot be proven. It remains allegations, but we go public about allegations. As a professional body, they were not even tested, those allegations. So I think it's very important to put that into record. Secondly, in the context of the allegations, the MDR TB hospital is a designated name for MDR TB hospital. We are not mixing people with COVID-19 with people who've got TB or multi-drug resistant TB. So there is no danger that these particular doctors are exposed to by being held in this facility. It is a gazetted facility that is going to be used for the COVID-19 isolation site. And the National Department of Health is fully aware of that. So there was no exposure to danger, and we advised that they should have checked their facts. Thirdly, the very MDR unit already had other patients. This was not a personal target, because it was an implementation by the Limpopo Department of Health that all those who are positive, because we are a resource-constrained province, we can't afford to risk them moving around. So it was not that when it comes to these doctors, we must then apply it selectively, yet other people, we had our own health professionals in the same facility who were COVID positive, our nurses, our professors in that facility already held. But when it comes to these particular doctors, then we must treat them differently. And this is where we say we differ with SAMA on that one. It can't be that because they are doctors, then they should be treated differently.
Now, Thokozani, if I can come in there, you mentioned that your province is a resourced, constrained department. Would you take on board then that part of the reasons for this guideline by the NICD, that those who test positive but that are asymptomatic, they're not showing symptoms as yet and are in a position to self-isolate in the correct way, that guideline is there specifically to ensure that resources that could be spent on people who are more seriously sick in connection to COVID-19 are then taken up in those state facilities?
No, the statement you are making is very correct. However, the onus is on the accounting officers to apply a guideline. It is not a rule of thumb, it's a guideline. In our province, we have already had lessons learned from people who are well-resourced as far as we are concerned, but had actually broken the very guidelines in terms of self-isolating, and they were moving around. It was based on those experiences that if we don't contain this so-called self-isolation, particularly on positive cases, we're going to be in serious trouble. So ours was within law and a pushback strategy to say the more we contain them and we are sure that indeed they are isolating, because right now we have got lessons learned about people that are positive. We cancel them, they've got good resources, but guess what? They still move around, and our own people cannot recognize them that they are positive. And when people are positive and asymptomatic, it doesn't mean they can't spread the virus. All cases so far in Limpopo were that criteria, positive and asymptomatic, but they continue to spread the virus. So it was a proactive measure. And when we talk about guidelines, we are talking about a tool that should assist you in making decisions, but it is not absolute. You still have to apply your mind. And as a clinician and as a leader and an accounting office, when the situation changes, you have the powers to review the situation and adapt the guidelines to suit your situation.
Thokozani, unfortunately, I just need to come in there just very quickly because we're running out of time. Just one last question I'd like to put to you. That there was concern that the way these two doctors were forced into a quarantine, that it was iron-fisted, and I'm quoting from the letter from SAMA, and that the unintended consequences there is that it could create fear amongst those who perhaps wouldn't want to be tested, and in that way it would be a negative for the health department to encourage people to come forward to get tested, and if they test positive to go into isolation and quarantine. What do you make of that?
Testing cannot be optional in this country at this stage. We don't talk about voluntary testing. So whether there's fear or no fear, you will be tested. Secondly, those doctors, we had to go and obtain court order, because when we asked them nicely, since Tuesday, saying can they move, they refused. They are the ones who said they will only move when we get a court order. We applied the regulations of the law. We went and obtained a court order. We came there. We waited for 3 hours. They were still saying they are studying the court order. And ultimately, we had no option. We had to implement the order as per their request. So there's nothing like feast and whatever. If they wanted to create a drama because they want COVID to make them popular, that's what they got. And indeed, this perpetrator is making them popular.
Okay, we're going to have to leave it there. Thokozani Mhlongo, thank you so much for your time. Unfortunately, we've just run out of time. She is the head of the health department in Limpopo.